All right, let's do blunt renal trauma. How do you crack a kidney? So blunt trauma means external force applied to the kidney. Can be car accident, significant, some type of force hitting the flank, rapid deceleration injury, a fall. All of these can crack what we call the capsule, which is the outer layer of the kidney, as well as the parenchyma or the meat of the kidney. Now, on physical exam, you may see a flank hematoma or a lot of bruising, but obviously most patients with a significant trauma are going to get a CT, but the guidelines say if a patient has blunt trauma and gross hematuria, meaning you see it with your own eyes, or microscopic hematuria plus hemodynamic instability, you need a CT with IV contrast. Like I said, most people are going to have this anyway. This allows you to grade the fracture. And we don't need to go into all the details, but grading looks at how deep the cut into the kidney goes, whether it goes into what we call the collecting system, which is where urine is stored because urine leaking out causes problems, and the extent of the vascular injury, whether the renal artery and vein are involved. Now, most patients are now managed conservatively, meaning that we actually watch this. The retroperitoneum is a space where the blood will contain itself and the kidney will often stop bleeding on its own. Now, sometimes if there's persistent hemodynamic instability, interventional radiology can do an embolization and plug up those blood vessels. In patients who come in with a lot of instability, they sometimes will go to the OR. But interestingly, once you open that space around the kidney, there's a good chance you're going to have to take it out. Now, if urine leaks out of the kidney into the tissues around it, depending on the severity, you may have to put a stent in and even a percutaneous drain to help that fluid escape while the kidney heals.